Thank you for that, Kelly. Well, spectators and athletes, meantime, from all around the world expected to descend upon Rio de Janeiro for the Summer Olympics this August. But competitors and fans alike, they're worried about the Zika virus. The U.S. Olympic Committee now hiring infectious disease specialists to advise athletes on Zika. Brazil has been most affected by the outbreak that is spreading through Latin America and the Caribbean. In fact, 1.5 million people in that country, Brazil, infected since early 2015. So let's talk about it with family physician Dr. Jen Caudle, an assistant professor at Rowan University. Thank you for joining us.
Thanks for having me.
So these stories about the Zika virus, they have been scary. So people are concerned. No doubt these athletes are concerned. Are their concerns warranted?
You know, I do think we should be concerned. I agree with that, but I don't think we need to be panicked. Really what we need to do is to be thoughtful about this approach. And think about it. Think about how much we've learned about the Zika virus in the last few days, in the last few weeks. Really what we don't know about Zika virus is just as important as what we do know. And there's a lot that we don't know. And I really think that in the next coming weeks and days, we're going to learn a lot more. So I'm really happy to see that they've hired infectious disease specialists to consult. But I really think that we have more to learn, and that's going to inform the decisions around the Olympics.
Yeah, and you mentioned what we do know, and I just wanted to ask you, how is it spread, and what type of precautions can these athletes take? Can all of us take, actually?
Right, absolutely. So that's always number one right there. First of all, we know that the Zika virus is spread through infected mosquitoes. That's first and foremost the main way that it's spread. We've also found Zika virus in semen as well. So sexual contact is something that we're keeping an eye on.
There have been a couple cases reported.
Absolutely. So in terms of prevention and protection, if people are traveling to these areas with Zika virus, the first thing comes with mosquito prevention and preventing yourself from being bitten by a mosquito. Make sure that you're wearing that mosquito repellent with DEET. That's the active ingredient that's really important. Make sure that you're wearing long clothing. That's like the sleeves. Make sure you're covering yourself with your pants. Make sure that you've got barriers. That means mosquito nets over your beds, closing doors and windows and things like that. And of course, avoiding pools of standing water, which is where mosquitoes like to hang out. Yeah. So it's really important there.
And these infectious disease specialists that are on the ground, they'll work to determine if, in fact, it will help if all the athletes can do that, and that will stop the spread, or will they determine that they shouldn't go?
Well, I'm hoping they're going to do a little bit of all of that. I mean, the hope really is that the situation is assessed appropriately. See, that's what people need. And really interesting, you bring up a really good point here. I've had a number of patients actually call me in the last week saying they've got vacations coming up. Should they travel? Should they not? That's what people want to know. And in fact, the World Health Organization just in the last couple of days, yesterday, released a report that said pregnant women should consider delaying travel to these areas. So what people need really is a risk assessment, understanding the level of risk to the athletes and to people traveling. That's what we need infectious disease specialists and health officials to do, to really give people sound advice to make the appropriate decision.
And it's not just pregnant women. Something that would specifically concern these athletes is the link to possible paralysis. What is that?
Right, so you're thinking of a condition called Guillain-Barré. So this is another link that we've seen with the Zika virus, that it's been linked to this Guillain-Barré, which is generally a rare sort of neurological condition that causes paralysis. We do see Guillain-Barré with other conditions and other things. It's not specific to Zika virus, but we're questioning whether the link is with Zika. So yes, there are concerns, absolutely, but my opinion is that we just need to be thoughtful and smart about our approach here.
And it would cause those two things to happen, the concern with the pregnant women, the possibility of the paralysis, but it's not deadly.
Well, no, and remember, let's put this all into perspective. Let's take a step back, okay? Because Zika infects millions and millions of people, or many people, let's put it that way. Only 1 in 5 people actually really show symptoms. And those symptoms for most people are some fever, maybe a little joint pain, rash, red eyes, and oftentimes those symptoms kind of go away on their own. So keep that in mind. We need to put this in perspective, that only 1 out of 5 will have symptoms, and it tends to be those things and often goes away. It's when we get into pregnant women and concerns about birth defects and some of these other concerns that it really makes this condition something more of a global issue that we've got to be thoughtful about.
Should the athletes go?
It really depends. It depends on who they are. It depends if they're childbearing age, et cetera. If they're pregnant, the risk assessment matters.
All right. Thank you so much for joining us.
Thank you.
Great insight provided for us. Kelly?